The Bellevue NYU program for survivors of torture, which is jointly sponsored by Bellevue Hospital and New York University School of Medicine, provides comprehensive medical, mental health, and social services to refugees and asylum seekers. Since our program began in 1995, we've now cared for over 2,000 men, women, and children from more than 70 different countries. What our program tries to do is to restore individuals' physical, psychological, and social health, restore their sense of trust and safety, and help them to rebuild their lives here in their new country. I am a Society Master for the Machin Society for Bioethics and Human Rights at NYU School of Medicine, and the Master Scholars Program is committed to promoting humanism and professionalism in medicine. Through that, and also in my work with torture survivors, I've learned about the crucial role that we as physicians and health professionals can play and must play in advocacy, advocating for our individual patients as well as for broader societal issues. And I see that there are four functions that we can and must play. So first is identification, that you need to be thinking about these issues in order to identify them. The second role that health professionals can and should play is in documentation, using our skills both as clinicians and as scientists in documenting human rights and profound ethical concerns. Then treatment, that core role that historically health professionals have played, providing treatment to vulnerable populations. And then finally, and perhaps most important, is advocacy. You need to speak out about what you've found, what you've seen, and try and strive to be a means for change. Don't presume if you don't speak out about an issue that someone else will. And we as health professionals historically, I think, have not done enough advocacy. We've been more comfortable in the role of medical care or research, but that we have a crucial voice to raise that really can change and impact on the public debate and change policy. Who better than the individuals sitting in the room with the patients or conducting these studies and have seen these things firsthand to speak out about the problems and disparities in access to health care, the horrific impact that torture can have, and why we as a society or we as a health profession must never practice or condone torture. In our work with torture survivors on a daily basis, I'm reminded of the cruelty and inhumanity that still exists, and that's all too alarmingly common. But I'm also reminded of just the extraordinary resilience of the human spirit. And so it's horrific to hear about these things that happen so commonly, so rampantly. But it's gratifying to know that there's a lot that we can do to help individuals who've been so brutalized get on with their lives and to help with the healing process.